Hello everyone, welcome to BAJIRAO IAS Academy, the Hindu News Analysis. So we have a few important news articles for today's discussion. So before discussing all those important news articles and also yesterday's given previous year question or important objective question, so please subscribe to our YouTube channel and also hit the like button. And in this discussion, I have been giving few very important questions. Please try to answer those questions in the comment section. So let's discuss the yesterday's given practice question. Which one of the following organizations or ministries have launched Ethanol 100 program? Please remember, ethanol is a biofuel and the government has a certain targets with respect to blending ethanol in petrol and diesel, because it is a biofuel and it does not come up with any negative emissions, so that that will have impact on the climate change. So because of that reason, the governments have been focusing on producing ethanol. So ethanol is a biofuel and this ethanol 100 program was launched by Ministry of Petroleum and Natural Gas. Okay, so B is the correct answer for this particular question. Now practice question for today. So Saki is a multi-purpose app. It was in news recently and it was developed by which of the following agencies? See, I have already discussed Saki in our previous lectures. So if you regularly follow our lectures, you can clearly answer this question. Okay, so Saki is a multi-purpose app. This was in news recently developed by which of the following organizations? One is National Informatics Center, A. B. National Crime Records Bureau, C. Vikram Sarabhai Space Center, and D. Bureau of Indian Standards. Right? So please try to answer this question in the comment section. Now let's try to discuss the first very important article that is covered in the Hindu newspaper, and this is with respect to eliminating diseases one region at a time. We all know that India is vulnerable to various diseases. India is located in the tropical region. Because of climate change and global warming, the spread of diseases, the intensity and the frequency of those diseases has been expanding at a faster pace. So therefore, in this context, India should have a strategy, a robust strategy that could deal with the diseases, that can eliminate the diseases, and that is very important, that India could reduce its disease burden. Okay, so in this article, the author has been discussing about eliminating certain diseases or one region at a time. So that is a strategy that was discussed by the author. So let's discuss this in a detailed manner. And what was the context of this particular editorial? So the context was the focus on disease elimination, particularly countries or regions like India, because it raises critical considerations regarding public health strategies, resource allocation, and regional implementation as well. When I say critical considerations, so if you look at the total public health care infrastructure in a country, still it is considered as suboptimal or underdeveloped. We need to revamp our existing public health infrastructure in order to meet the requirements of those diseases which have been increasing their respective spread. And this is the first strategy to eliminate the spread of those diseases. And after that, resource allocation is also a major problem. For example, if you look at total healthcare spending, it is less than 1.8% of India's total GDP. Even though National Health Policy has recommended that India's healthcare spending should be 3% of the GDP, even we are not spending 2% of our GDP on the healthcare sector. So therefore, resource allocation is also a problem that could result in new challenges in disease elimination, tackling new diseases. And at the same time, so if you have devised, or if we have devised any new strategies, any policies, how can we implement those policies across different regions? How can we achieve the center-state cooperation? And that is also important, and that plays a very important and crucial role in overall disease planning and disease elimination. Given here a health report of different diseases. For example, Here there is a list of non-communicable diseases. Okay, so non-communicable diseases, unlike COVID-19 pandemic, they don't spread from one individual to the another individual. I mean, they're not contagious in nature. Okay, so those diseases are not contagious in nature. They don't spread from one individual to another individual. However, so those non-communicable diseases have been posing one of the a major challenge to existing public health care infrastructure in India. For example, diseases like cardiovascular diseases, heart stroke, heart attack, and injuries, and communicable maternal, perinatal, and nutritional diseases occupying 28%, and cancer constituting 7%, respiratory diseases 13%, and diabetes 2%. Okay, so this is actually the share of diseases or deaths caused by different diseases. If you look at the cardiovascular diseases such as heart related diseases, it contributes to highest amount of mortality, followed by firstly communicable diseases, maternal, perinatal, nutritional deaths have been highest share of total mortality, followed by the cardiovascular diseases. Please also understand, in India around 2/3 of women are suffering with anemia. Okay, so anemia essentially means iron deficiency among women. So apart from iron deficiency due to lack of enough nutrition, we have been seeing higher infant mortality rate as well as higher maternal mortality rates. So therefore, this is what this particular statistics or data has been revealing. However, so here some neglected tropical diseases are also given. Neglected tropical diseases, most of the diseases that we see in the tropical regions, however, they are known as neglected tropical diseases because the medicines are not easily available for those diseases. Vaccination is not easily available for those diseases. Generally, they're considered as neglected diseases because the pharmaceutical companies do not spend enough resources on manufacturing and finding out new vaccines, new medicines for these diseases. Because of that reason, they are known as neglected tropical diseases. So few diseases which can be caused by rabies viruses include rabies, dengue, and chikungunya. So those are the diseases which are caused by viruses. And followed by virus, bacteria caused diseases are leprosy, trachoma, and IAS. And protozoa also causes certain diseases such as Chagas disease, leishmaniasis, and human African trypanosomiasis. Okay, so these are the diseases which are caused by microorganisms such as protozoa. And apart from that, helminthis also causes certain diseases. So those include guinea worm and foodborne trematodiasis and lymphatic filariasis and soil transmitted helminthiasis and river blindness. So those diseases are actually caused by helminth species or helminth microorganisms. So these are some of the neglected tropical diseases. Even though the author has not directly mentioned about these neglected tropical disease, in the context of India's disease burden and in the context of eliminating these diseases, it is important to mention all those diseases. Now, so the author has been suggesting about a disease elimination strategy. Okay, so what his or her views on this particular disease elimination strategy. So differentiating elimination from eradication. Okay, so the author has been suggesting that elimination is different from eradication of the disease. So disease elimination essentially aims at halting the transmission in defined regions, and that is distinct from the eradication. Okay, so elimination of disease actually means halting the transmission of the disease. For example, we all know that the COVID-19 pandemic is a disease. So in the context of elimination of this particular disease, when we talk about the elimination of COVID-19 pandemic, so we just aimed at halting the spread of this particular disease, halting the transmission of this disease, and that is known as elimination of disease. And this elimination is distinct from eradication. So eradication essentially means permanent cessation globally. So globally, there are no individuals who are impacted with one particular disease, and that comes under the category of eradication of a disease. Now, the strategy energizes public health systems and enhancing primary care and surveillance. So the author has been suggesting that in order to eliminate these diseases and move on further towards eradication of these diseases, we need to focus on the public healthcare system. We all know that the public healthcare system can provide important interventions in the total healthcare, because they were the first responders at different levels, whether it is a local level or even at the block level. So therefore, we need to revamp our existing primary healthcare centers, and we should also further enhance surveillance against those diseases. So when surveillance against those diseases has increased, we can come up with appropriate interventions in this regard. So that will help us tackle those diseases at a much earlier stage. So this is what the author has been emphasizing on. However, we have certain benefits and challenges also while planning to eradicate or eliminate those diseases. Now, what are the benefits and challenges? So rigorous certification requirements improve diagnostics and attract the international support. See, when we have the rigorous certification requirements for various diseases, to certify diseases or to manufacture medicines, so that definitely improve the accuracy in the diagnostic process. And diagnostic process and improving its accuracy and efficiency is very important. And that could also attract the much needed international support for our efforts. And apart from that, the resource intensity may strain weak health systems. As I have already told you that India has been spending less than 1.8% of its GDP, 1.8% of its GDP on the public healthcare system. So therefore, we have been facing constraint in terms of spending those resources. So this resource intensity may strain weak health system. Okay, so already weak health system may be impacted by the poor financial resources allocation. So therefore, it necessitates a careful cost benefit analysis and even the political commitment also. Okay, so without political will and political commitment, we cannot move forward and achieve the goal of eliminating or eradicating these diseases. So therefore, resource allocation should also be prioritized. And after that, the author has been suggesting a strategic focus on this issue. So when I say strategic focus, prioritizing diseases or prioritizing certain diseases with a very high impact. So there are certain diseases which have a higher impact. So therefore, we need to prioritize those diseases. And those diseases which have low prevalence for elimination allows for a feasible outcome. Okay, so identify those diseases which have the higher impact on the human populations and they are low in prevalence for elimination allows for feasible outcomes. So this is the first strategy that the author has been suggesting. After that, the initial disease control efforts that pave the way for understanding elimination processes and strengthening the health systems also. Okay, so initial disease control efforts that are being undertaken by the government and various other agencies, they actually pave the way for understanding the total overall process of eliminating these diseases, and at the same time strengthening the healthcare systems. Because when we come up with interventions, when we understand those diseases and disease patterns, disease cycles, it gives us a better insights to deal with that particular disease, and it will help us strengthen our existing healthcare systems. And this is what the author has been suggesting. However, the author has also been suggesting a need for surveillance system. So earlier I've already told you how surveillance system will help. For example, if we have a robust surveillance system against various diseases, we can come up with early interventions on those diseases. We can frame appropriate policies to deal with those specific diseases. So therefore, we need to enhance our existing surveillance mechanism and surveillance systems. And in this regard, the author has been suggesting investment in the surveillance mechanisms. When he says investment in the surveillance mechanism, developing robust surveillance systems and laboratory capacities have to be further strengthened, and workforce training need to be provided. So they are very essential and very important for effective disease tracking and confirmation also. Now, if you look at the public healthcare staff, they lack essential training, and that particular training is very important, and our existing laboratory presence is also very poor. And apart from that, even though there are laboratories, those laboratories lack essential equipment. So therefore, we need to invest in surveillance, and all these things comes under the revamping or enhancing the surveillance against those diseases. So after that, the author has also been suggesting some tailored approaches to different challenges. Okay, so the nationwide elimination may be challenging. For example, imagine a disease, and that particular disease, we cannot eliminate the disease at the national level. Okay, so immediately we cannot eliminate any disease at the national level, and that may be challenging, and this is what the author has been suggesting. However, targeting specific diseases in certain regions, for example, imagine Kerala, Karnataka. So that they have been suffering with a disease called Casanur forest disease. So here the author has been clearly suggesting that targeting specific diseases in certain areas like Kala Ajar in limited states, Japanese encephalitis in limited states, so allows for achievable goals and the localized strategies also. Okay, so when we have been localizing our planning to deal with those diseases, then that would give more fruitful results in dealing with those different diseases. And this is what the author has been suggesting. So we need to come up with localized strategies using the existing goals. And after that, the author has also been suggesting regional collaborations. When I say regional collaboration, if the central government has decided to deal with the particular disease, central government alone cannot do it on its own in silos. However, on the other hand, central government requires active cooperation and collaboration from the state governments and at the same time the local governments. So that is the better way to deal with the diseases, and that is a better way to eliminate and eradicate those diseases, and that is what the author has been suggesting. So regional elimination efforts benefit from multi-sectoral collaboration. So when I say multi-sectoral collaboration, involvement of center, involvement of state governments and respective ministries, and even the private medical institutions, okay, and at the same time the local governments. So it benefit from the multi-sectoral collaboration, innovation, and the resource allocation also. So these things are very, very important when we are focusing or targeting to eliminate and eradicate certain diseases. And after that, the national ownership with a phased regional scaling ensures effective monitoring and control of reintroduction. Okay, so overall, the author has been emphasizing on the multi-sectoral cooperation and collaboration to deal with those diseases, so thereby ultimately reducing overall disease burden that India has been facing. Okay, so next important article, this is with respect to recently few states in South India have banned certain food items. Okay, so for example, the Manchurian and also this cotton candy, the image you can see. So why those state governments such as Andhra Pradesh, Karnataka, Telangana have banned Manchurian and this particular cotton candy? So they have banned these food items because they have been using the artificial colorants, artificial colors that have been containing chemicals, and they are very harmful and injurious for the health of the people, and they even cause cancer. They even cause cancer in the human beings. Okay, now we will understand why has Karnataka and other southern states have banned these two items, these two food items. So Karnataka became third state in South India to ban the use of certain coloring agents. Okay, so they have banned use of coloring agents in cotton candy and even the gobi Manchurian. So they very often found harmful to human health, or hazardous to human health, and because of that reason using these coloring agents is banned by the Karnataka government, similar to Tamil Nadu government and Andhra Pradesh government also. Now if we can talk about this in a detailed manner, the extent of contamination, in order to understand the extent of contamination by these chemicals in the food products, a survey was conducted. So the survey was conducted by the Public Health Department of Karnataka. So this particular Public Health Department of Karnataka has revealed that an alarming findings. Okay, so this particular survey has revealed certain findings regarding the presence of harmful chemicals in the food samples. So this survey says there are certain harmful chemicals that are present in the food products, and it has also collected samples out of 25 cotton candy samples that are being collected by the Public Health Department of Karnataka. 15 samples are deemed unsafe for consumption, unsafe for human consumption due to presence of added colors. So these colors have certain chemicals and they are harmful to the human health. Similarly, 171 samples of gobi Manchurian collected so far by the Public Health Department in order to assess the quality, in order to assess the safety of those food products. Out of 171 samples collected of gobi Manchurian, 107 were declared unsafe as they contained added colors. Okay, both gobi Manchurian and even cotton candy have the added colors and that are being harmful to the human consumption and human health. So immediate action was prompted by the Karnataka state government after these findings. Okay, so prompt action was taken by the government of Karnataka following the survey results of Public Health Department, and this particular prompt action essentially to meet the challenges that are being posed by the contaminated food items and that are being widely sold. So these cotton candies are primarily purchased by the children, and they have the artificial coloring agents, and those coloring agents will cause cancer among the people who consumed these coloring agents or food products which are having these coloring agents. Okay, so next we will discuss about the harmful chemicals that are being used in these food products. Okay, so 1 minute. Sorry. So it also talking about the harmful chemicals that are being used. Okay, so harmful chemicals that are being used in these food substances. Okay, so when I say harmful chemicals, so there are certain chemicals which are considered harmful for the human consumption. Okay, so unsafe samples of cotton candy contain traces of sunset yellow and tetragyne and rhodamine B also. Okay, so please remember these chemicals because UPSC has been asking questions from these similar things. Okay, so those are sunset yellow and tetragyne and rhodamine B. And at the same time, the unsafe gobi Manchurian also have certain chemicals. So those are tetragyne, sunset yellow and carmozine. Okay, so these are the basic chemicals that are used as a coloring agents in the gobi Manchurian as well as cotton candy. However, there are certain regulatory restrictions with respect to these chemicals. So tetragyne, though an approved official food color, okay, so this particular tetragyne, so we found this tetragyne in both gobi Manchurian as well as cotton candy. So there are certain regulations with respect to the use of tetragyne. So tetragyne approved artificial food color, but it has restrictions on its usage, especially in a freshly prepared food items. Okay, so these are restrictions or regulations with respect to tetragyne coloring agent. However, the prolonged consumption of snacks with these artificial coloring agents linked to several health issues or severe health issues such as cancer. Okay, this was revealed by the health officials. Okay, so if we continuously eat these coloring the foods which have been contaminated with the coloring agents, so they can cause cancers among human beings because they consist of certain harmful chemicals such as sunset yellow, tetragyne and rhodamine B. However, there are certain public health concerns with respect to this. Those are presence of these harmful chemicals in food items poses significant risks to public health and leading to the urgent need for regulatory action. So as part of the regulatory action by the governments, so those state governments have already banned the use of these coloring agents in the food, both cotton candy as well as the gobi Manchurian. So the third dimension, so if anyone violates this particular norm or this particular rule from the government that if anyone have been using these coloring agents in food products, there are certain penalties, and how the government enforces those penalties we will discuss. First and foremost, the legal ramifications available if anyone have been using it in an illegal manner. The Food Safety and Standards Authority of India, that about which we have discussed yesterday, so it was formed through a legislation in the year 2006. Okay, so the Food Safety and Standards Authority of India has been imposing strict penalties. The strict penalties including fines and jail terms for violating the regulations under the food additives, and FSSI primarily prevents food adulteration. Okay, so it primarily prevents the food adulteration in India. So apart from that, FSSI has been imposing penalties as well, as I have already discussed with you about this. So if anyone have been using these artificial food colorants or food coloring agents or banned chemical substances in food products, so they face fine of up to 10 lakh and an imprisonment that is being ranging from 7 years to life imprisonment, keeping in mind the larger public health in the mind. So after that, the immediate enforcement is also another factor that regulates the use of these coloring agents. So the ban on these chemical agents is immediately effective, and at the same time stringent enforcement measures were also started enforcing. Okay, so the government started enforcing those stringent measures, and if anyone violates those measures or rules that are being provided by the government, so that will lead to license cancellation. Random checks will also be undertaken in order to assess that anyone using those coloring agents illegally. So yesterday we have discussed about the Food Safety and Standards Authority of India also, and what should be the way forward in this regard. In this particular regard, what should be the way forward? So in this regard, the government must run the awareness campaigns in the public that see certain individuals have been using the coloring agents which are harmful or hazardous to public health. So therefore you need to be cautious about those things. So public awareness campaigns are very important. So government aims to raise awareness among the manufacturers and consumers regarding the hazardous nature of those coloring agents. Okay, so after that, the consumer caution is also a very important factor. So when I discuss about the consumer caution, consumers are urged to exercise caution and at the same time minimize the consumption of food items prepared with the artificial colors as well. So consumer caution will also help consumers avoid the food products which have the coloring agents, so thereby protecting public health and at the same time discouraging the food products which use harmful coloring agents. Okay, so these are the benefits that are being associated with it. Now next, we need to expand the scrutiny as well. So we already knew that those chemicals such as rhodamine B, tartragine are harmful for the public health. So therefore the scrutiny has to be further increased so that no one will violate those rules and regulations and no one will use those artificial coloring agents, thereby protecting the larger public health. So apart from gobi Manchurian, so other food products potentially containing these harmful chemicals or harmful coloring agents such as kebabs, they should also likely undergo the scrutiny. So when we scrutinized those food products also, we can alert the public about the potential harm that is being caused by these artificial coloring agents. Okay, so that's all in this lecture about this artificial coloring agents and ban of those artificial coloring agents by the Karnataka government. And next we will briefly discuss about the fact check unit. Okay, Press Information Bureau fact check unit. Okay, so recently Center notifies a fact check unit to screen online content. Okay, so this is with respect to prevention of spread of fake news. So we all know that fake news has become a new normal in today's world. So people have been increasingly spreading fake news across different social media platforms, and fake news very often comes with several negative consequences. Okay, so in order to deal with the challenge of fake news, the central government has notified rules. Okay, so the central government has notified the IT rules 2021. So these IT rules 2021 have set up the Press Information Bureau as the fact checking unit. Now Press Information Bureau will be the fact check unit and it will alert the concerned ministry about the potential fake news, and we will understand this in a detailed manner. Okay, so as I have already told you, Center notifies its own fact check unit under the Press Information Bureau. Now what exactly this fact check unit by the Press Information Bureau? So yesterday Center has notified the fact check unit under the Press Information Bureau, and it was even authorized by the Union government also. Now, so this particular fact check unit under Press Information Bureau was set up under the Information Technology Rules of 2021, and this is what I have already told you. Okay, so this fact check unit was set up under the Information and Technology Rules of IT Rules of 2021. Okay, so these were amended rules of 2021. So under this, a fact check unit under PIB was established in November 2019. Okay, so the overall objective of this particular fact check unit under PIB is acting as a deterrent to creators and disseminators of fake news and misinformation. Okay, so this will create a deterrent effect on creators and disseminators of fake news and misinformation online. Okay, so thereby preventing the potential negative consequences of spread of the fake news. And apart from that, it will also provide people with an easy avenue to report the suspicious and questionable information pertaining to the government of India. For example, if anyone circulating the suspicious and at the same time questionable information on government schemes, government policies and government programs, So any citizen can report such information to the Press Information Bureau's fact check unit. So therefore it says it provides easy avenue for the people to report the activities, the questionable and suspicious activities or information. And apart from that, the fact check unit under the Press Information Bureau is mandated to counter misinformation on the government policies, initiatives, schemes, either suo motu or through reference via complaints. For example, you are being a citizen and you can complain any misinformation or questionable information to the fact check unit of Press Information Bureau. Okay, so this is one way. And the other way is that the fact check unit of Press Information Bureau can also take up any issue or any information on its own, that is suo motu. So the fact check unit actively monitors, detects and counters disinformation campaigns. Okay, so there are certain disinformation campaigns that are actively run online. So therefore it monitors, detects and counters disinformation campaigns and ensuring that the false information about the government is promptly exposed and corrected by the government agencies alone. Okay, so this is what the fact check unit of the PIB usually do. And apart from that, the fact check unit will take call on whether online information related to the central government is accurate or it is a false information. Okay, so ultimately the government will take a decision on the information. So one thing that you need to understand here, so there were journalists and even media has been criticizing this particular fact check unit. Why media has been criticizing a fact check unit? Here the government has been deciding which information is fake information, which information is misinformation and which one is legitimate information. For example, imagine a media. Okay, so imagine one particular newspaper, one particular news channel has been criticizing the government. Okay, so it has been criticizing the government and the criticism is credible in nature. And then also the fact check unit of the government intervenes and labeled this particular content as misinformation and fake news, and thereby ordering the intermediaries such as YouTube, Facebook and Twitter, formerly known as Twitter, now it is X, to remove this particular criticism from the online. Okay, so therefore it will have a lot of negative implications on the free speech and it is also amounts to the violation of Article 19, freedom of speech and expression, free journalism. So because of that particular reason, the fact checking unit under the PIB is strongly opposed, since it has been violating Article 19, free press and freedom of speech and expression. So they have also countering this fact check unit as unconstitutional, illegal, right? So this is what we have discussed so far. So the government will brand or certify whether any information is misinformation or a fake information, right? So the body, that is fact check unit, will have the authority to label content related to the government on online platforms like Facebook, Twitter as fake and misleading. And apart from that, a content which is being flagged by the unit will have to be taken down. If they wish to retain this particular content, they will remove the safe harbor, which is actually a legal immunity that they enjoy against any third party content. Okay, so I will explain you clearly. For example, imagine someone criticized the government, and those individuals have posted something on the Twitter or now X, okay, a social platform called X, and they have criticized the government. So the criticism is considered credible criticism, a constructive criticism of the government. However, the government's fact check unit labels this particular criticism as misinformation and fake information on the government. So then the fact check unit under the PIB notifies to the X, the social media platform X, that this particular content must be removed from the your platform, because here X is intermediary. However, if social media platform or the intermediary decides to keep the content, they will remove the safe harbor. Safe harbor that is being provided under section 79 of the IT Act to these social media intermediaries. Okay, so that provides safe harbor to these social media. For example, if anyone provides, if anyone has posted hateful comments in Twitter, if anyone posted hateful comments in Twitter, Twitter will not be responsible for such hateful comments because they are posted by a third party. Okay, so Twitter will not be responsible because it has been enjoying the safe harbor under section 79 of the Information IT Act. So however, if those platforms such as social media platforms such as Twitter loses the safe harbor, the government will make the Twitter liable for the hate speech that is being spread in the social media platform, and that will face the legal consequences later. And this is what the government has said with respect to the fact check unit. However, the social media sites will have to take down such posts, otherwise they will lose their safe harbor mechanism. I hope you have understood the safe harbor mechanism. And even internet service providers will have to block the URLs of such content. So in fact, recently a petition was filed in the Bombay High Court on March 14 to March. So Bombay High Court, the petitions were filed that the fact check unit, government branding information, government certifying information as misinformation or credible information is something which is unconstitutional and illegal and even violates fundamental rights under Article 19. However, the Bombay High Court has refused to impose a stay on setting up the fact checking unit. Okay, so under the information technology rules. So they have asked the High Court that this particular fact check unit should not be set up because it is illegal and arbitrary. It has been curtailing the free speech of the people. However, the Bombay High Court has refused to impose a stay on the fact check unit under the Press Information Bureau. Now, how the fact check units work flows. For example, a citizen organization can submit fact check complaints through WhatsApp. Firstly. Secondly, I've also told you that the fact check unit of PIB can also take matters of misinformation and fake information suo motu cognizance and to flag that particular content. So does it need to be fact checked? Yes, if any citizen send information to the fact checking unit, that has to be fact checked. Any open source information available or not with respect to that particular information. Okay, so after that, the content is labeled and posted on social media, communicated separately to the applicant if any information which is available online. So if no information is available, any open source information is not available, and that information will be sent to the particular ministry to decide on its authenticity. Okay, so to clarify about that. Okay, so this is how the fact check unit of the PIB works. So after that, there's a proposed structure also, this fact check unit. Firstly, there will be an oversight committee, there will be a review of SOPC, and after that there will be nodal officers also, and it will contain a fact check team, and the fact check team is actually responsible conducting fact checks and at the same time responsible for communication and outreach also. And there's also an analytics team, and this particular analytics team is responsible for monitoring information ecosystem, providing early intelligence and tracing of key information disorder nodes. After that, there will be capacity building team also. So capacity building team is actually tasked with improving the awareness or enhancing awareness or undertaking the awareness generation campaigns among the people, and at the same time building applications for strengthening the overall ecosystem. Okay, so this is the structure of the fact check unit of Press Information Bureau, and that flags down misinformation or fake information about the government and government policies. Okay, so that's all in this lecture. Please like the video and also subscribe to our YouTube channel and comment the answer in the comment section. Thank you.